unintended weight loss, fever, night sweats, yung mga ganyan, chills, loss of appetite, no? Kaya tinatawag na nagkakaroon pala ng weight loss kasi nagkakaroon ng loss of appetite. And of course, yung isang sign na para malaman na meron talaga TB is hemoptysis. Although I'm not saying na kapag ang hemoptysis is coughing of blood. Hindi naman porket nag-cough ka ng blood, may TB ka na. But there's a chance na if you're coughing for more than 3 weeks, and then you're having chest pain, difficulty of breathing, bigla ka nanangayayat, nilalagnat ka, and then bigla ka nag-cough up ng blood, there's a chance na meron ka talaga tuberculosis. But, people would have to remember, merong vaccine against tuberculosis. And bata pa lang binibigyan na tayo nito eh. This is BCG, or Bacillus calmette-guerin. However, in the Philippines kasi, there are about, I think 200,000 to 600,000 mga ganon, kadaming people with active TB right now. So, most of us pwede na rin merong latent TB, o yung hindi siya active na TB. Okay naman yan.
Final question, what are the causes of lung cancer?
Okay, so just like any other types of cancer, genetic predisposition always play a role. Familial predisposition. Sabihin, kapag mayroon kang family member who had this type of disease before, there's a chance that you can get that also. However, there are other external factors, no? Pwedeng air pollution if you're living in a highly urbanized area, yung mga lugar na maraming vehicles, pwede ring asbestos exposure. However, dati kasi maraming gumagamit ng asbestos. So, this is actually an occupational related or work related risk. Ibig sabihin, pag nagtatrabaho ka sa asbestos plant, mga ganyan. Pero ngayon, naban naman na asbestos. So, pwede rin, if you had lung disorder, lung disease before, like COPD or chronic obstructive pulmonary disease, this also increases the chance of you developing lung cancer. Pero syempre, the highest risk comes from cigarette smoking. Okay? It can be in two types. Pwedeng passive smoker or active smoker. Kasi 80 to 90% ng lung cancer is caused by smoking. When you say passive, so if you're living with someone who smokes, the chances of you having cancer can increase to 24%. No? Also, pwede rin sa occupation related, especially those working sa mga bar, mga smoking area, sa mga casino, ganun. So, pwede rin mag-increase yung risk nila of developing cancer. Yung pinakamataas, syempre, yung active smoking. So, it depends on how much you smoke per day. There are people who can smoke 2 packs per day. So, for if you say 10 years na sila smoking 2 packs per day, that's 20 smoking years. So, that increases the chance of them having cancer. Kasi ang cigarette smoke or tobacco, ang sigarilyo, apart from the tobacco itself, has 4,000 other chemical compounds that can cause cancer, or what we call carcinogenic. That's the term used. So, yun, pwedeng air pollution, pwedeng previous disorder, pwedeng asbestos poisoning, pwedeng familial predisposition, and of course, number 1 is smoking.
Thank you. Follow-up question, what are your opinions about the smoking ban?
The smoking ban will be good, not only for those who smoke, but also for the passive smokers, yung sinabi ko kanina, no? Na kahit na-inhale lang nila yung cigarette smoke, even if they're not smoking it, increases the risk of them developing cancer. Number 1, para sa health ng mga smoker. Number 2, nakakatipid pa sila kasi they don't have to buy cigarettes. I heard na since tinasan yung taxes, medyo mas mahal na rin ang sigarilyo ngayon. So it's actually beneficial for the country.
Thank you. Iwan ng mga taong mahal natin.
Kasi di natin inaalagaan ang lungs natin. Bakit? Nagtutuglo siya mo.